Canada's premiers have gathered and their target, the federal government. I'm Adrienne Batra. Brian Lilley is our political columnist at the Toronto Sun. Okay, Brian, the provincial leaders have gathered. They always go and say the federal government needs to give more and more and more. Did they do that again this time?
Yeah, they did. And look, there's a lot of cynicism about premiers gathering and asking for more money. Pierre Trudeau famously said, "I'm not your head waiter," regarding the premiers. And every prime minister has viewed them as meetings with the premiers as gripe fests. You know, you're going to sit there and complain and you're going to say, we're not doing enough. The difference between then and now, and I've been covering these provincial premiers conferences going back more than 15 years now. Trying to remember. I remember Ralph Klein being at them and Ernie Eves and things like that. So it's been a while that I've been covering these. These guys are more united than I have ever seen any group of premiers. And their ask is very specific. They want an increase from 22% of health costs being covered to 35%. They're not asking for a 50-50 split. And these are premiers who represent Liberal parties, New Democrats, Conservatives of all different stripes. And they're all saying the same thing. And that's what's so amazing. John Horgan was the chair of the Council of the Federation. He, headed up the meeting, headed up the news conference, came out, made a speech. He's doing a lot of work with Trudeau. He's a left-wing New Democrat. He said the same thing as Doug Ford sitting next to him, as Francois Legault on the other side, as Andrew Furey, the very close ally of Justin Trudeau, who's the Premier of Newfoundland and Labrador. They all said the same thing. And they all chided the federal government, by the way, for negotiating through their state broadcaster, CBC.
There's always that whole notion. There was another famous politician, former Mayor Rob Ford, who always said, there's only one taxpayer. And so as one hears this going on between the province and the feds, it's all coming from a similar pot of money. And Canadians have to wonder, after going through the pandemic, how is our healthcare system in such shambles? How are we finding ourselves in this situation with likely, if you add it all up, hundreds of billions of dollars going into the healthcare system? So if you want to point fingers and look at the blame game, where do Canadians look, Brian?
Well, there's lots of blame to go around everywhere, from local hospital administrators to provincial governments to the federal government. We need to become innovative. We need to stop having this idea that everything needs to be done in the hospitals, for example. That's something that we talk about in Ontario. The Ontario Hospital Association, which became so prominent during COVID, they don't want to give up the ability to handle simple surgeries like cataracts or hips and knee surgery, even though those can easily be done in independent health facilities, the types of facilities, by the way, used in the UK in their public health system. But they say, no, we have to be the ones in charge. Don't allow these organizations to operate, even though the average Canadian wouldn't know the difference. They just go in, hand over their health card, get their service and leave, like we do anywhere else. But they don't want to give that up. They want it inside the hospitals, but they can't handle what they've got going on now. They're horribly managed. They warn about the private sector being involved and yet pay their hospital CEOs like they're running a major bank. So there's a lot of blame to go around at all levels. Let's start being innovative. Let's look at what other jurisdictions do, whether it's inside Canada or in other places with a single payer system like the UK, like France.
It sure would be nice if just one of those premiers emerged from that meeting with that very notion of being innovative and creative within the system. Log on to Facebook and Twitter. Let us know what you think. And don't forget to subscribe to our YouTube channel.